Cholesterol is important because it is one of the causes of cardiovascular disease. Cardiovascular disease is the major cause of death in the United States. The second through seventh leading cause of death, all put together, don't cause as many deaths as cardiovascular disease. Cardiovascular disease is essentially when the arteries get stopped up. And as they get stopped up, the blood cannot get through and it forms a clot, and that causes a heart attack or a stroke. There are many different causes of cardiovascular disease. Some of them are cholesterol, high blood pressure, diabetes, age, sex, race. Some of them we can change and do something about, like we can keep our cholesterol under control, we can keep our diabetes under control, we can keep our blood pressure good. Some of them we could not do anything about. So it's important that we get the ones that we can control and keep those problems under control to keep from getting cardiovascular disease. Cholesterol is a waxy substance that goes through your bloodstream. Some is produced by your body's liver, and some you get from the food you eat. Cholesterol is important to your body because it helps your body produce different tissues, it helps your body produce vessels, it helps your body produce hormones. The problem is when you have too much cholesterol, it also causes the arteries to get smaller. This model shows the cholesterol, which is the yellow spots going through the artery, and when you have too much, it gets in the lining of the artery, and as you can see on this, when the cholesterol builds up, the artery gets smaller, and that's when you have a clot, which causes the stroke or heart attack. When you get your cholesterol checked, usually it will show you your triglycerides, which are the fats in the blood. It will also show you the different types of cholesterol besides the total cholesterol. You will have the LDL, which is sometimes called the bad cholesterol. You'll have the HDL, which is sometimes called the good cholesterol. Some of the tests will also have what is called a VLDL, very low density lipoproteins. These are important also. When you get your blood test done, the doctor will go over the results with you and tell you whether these numbers are high or low. Obviously, the bad cholesterol needs to be lower, at least below 100. If you have any cardiovascular risk factors, like if you have high blood pressure or diabetes, or a strong family history of cardiovascular disease, your doctor will want your bad cholesterol less than 70. The good cholesterol is the HDL, and you will want that to be as high as possible. We can lower our cholesterol in several different ways. I will talk about the different types of cholesterol, and in each type I will talk about how to lower your cholesterol. The best ways to lower the bad cholesterol are diet and or medications. The different medications for the bad cholesterol include statins, which work in your liver, other type of medications which help keep you from absorbing the cholesterol out of the food that you eat. All of these medications have risks and benefits and side effects, so you should discuss those with your doctor before you start taking them. To raise your good cholesterol, the best way to do that is exercise. If exercise is impossible for you, there are some medications that will help improve your good cholesterol. You can talk to your doctor about those. As far as the triglycerides, the best way you can lower your triglycerides is to lower the fat intake of your diet, decrease the amount of sugar that you eat, and decrease the amount of alcohol that you drink. There are several things that we can do to lower the cholesterol ourselves. We've already talked about the triglycerides and the good cholesterol and the things we can do for that. To lower the bad cholesterol, we should lower the amount of animal products that we consume. As far as what animal products, we should eat less meat, less milk, less eggs, and less cheese. When we do have meat, try to have the more healthy meats like the chicken and turkey and fish. Try to stay away from the beef and the pork and the shellfish. When we have eggs, try and limit the egg yolks to a couple a week. Otherwise, have the egg beaters or the egg whites. When we have milk, try to have skim milk. Stay away from the 1%, 2%, or whole milk. When we have cheese, try to have the better cheeses such as mozzarella, which is low in fat. There are some natural products that you can use which will help your cholesterol. As far as for the triglycerides, the omega-3s, which are found in fish oil, are very good at lowering your triglycerides. They do raise your bad cholesterol just a little bit. There are a lot of other natural products that are good for your cholesterol: red rice yeast, oat bran, garlic, and several things that are advertised, and those do help your cholesterol a little bit. It's best to talk to your doctor about using the natural products before you use them.